This counseling session is based on Rob, a 76-year-old male diagnosed with dementia of the Alzheimer's type. Rob was presented to a neurologist after a referral from his primary care physician where he received this diagnosis. He was brought in to see the speech-language pathologist by his wife, Mary. Mary reported that her husband has been disoriented to time and place, has difficulty remembering personal information and locations, and has difficulty with complex motor tasks such as simple home repairs. In terms of his medical history, Rob has cardiomyopathy, which is an acquired or hereditary disease of the heart muscle, and high cholesterol. Cortical atrophy was noted on Rob's last MRI with enlarged sulci. Rob is a retired cop. He enjoys cooking, but recently has not been able to do so due to safety and his cognitive decline. Weekly activities for Rob include grocery shopping and daily walks with his dog around the neighborhood. Rob and Mary have 2 grown children and 4 great-grandchildren. Today, Marissa will be playing Rob, Olivia will be playing Rob's wife, Mary, and Anna will be the SLP in a private practice setting. Mary and Rob have been married for 50 years, and Rob has recently been diagnosed with dementia of the Alzheimer's type by his neurologist. Mary recently contacted Anna's private practice with concerns of how to restore his memory and wanted strategies to help his cognition. This is the first time Anna is meeting Rob and Mary. Anna recently read the neurologist's report, which mentioned Mary's struggling to accept his diagnosis and concerns of prognosis for this progressive disease.
Hello, my name is Anna. I'm the SLP.
Hi, my name's Rob.
Hi, Rob.
Hi, Mary.
Hi, nice to meet you both.
Nice to meet you.
So, Rob, I read over your file a little bit. I got a general sense of how you've been feeling and your diagnosis, but I just kind of wanted to hear from you in person about what your concerns are and what brings you in today.
So, lately I've been noticing that things that I used to do on an everyday basis are becoming really difficult for me. Just the other day, I went for a walk around my neighborhood with the dog, which I do every day, and on my walk, I couldn't figure out how to get back home. And when I looked around, nothing looked familiar, so I just stood there and started to cry because I didn't know what else to do.
Yeah, luckily our neighbor was there and saw him and was able to bring him back home.
Yeah, I really don't know why these types of things keep happening to me.
That must have been really difficult for you to go through. You seem concerned that these things might happen again.
Yeah, I'm very concerned about my husband's safety. Not only is he forgetting where he is, but he can't remember to do simple things like take his heart or cholesterol medication, which is super important. I don't feel safe leaving him at home, and I volunteer at a soup kitchen 4 days a week, so it's becoming a difficult situation to manage. This diagnosis of Alzheimer's has been very overwhelming for the both of us, and we don't know what our future holds. We haven't gotten much information about the disease, so I've been wondering what can be done to fix it.
So those are all concerns that we can address here on out in our sessions. Just a little bit of information behind dementia. It is a progressive disease, so the symptoms may worsen over time. Some of the symptoms that you see now may differ later on. So really right now the concern is what we can do to help you here on out. I have some handouts that may become handy for you to look at. It's about Alzheimer's and where it falls underneath the category of dementia. So dementia is an umbrella term and Alzheimer falls underneath it. And here some of the symptoms are categorized within Alzheimer's, but there's other symptoms that may show up later. And if you guys have any questions for me, please just let me know, but this handout is for you both to take home.
Yeah, I've been noticing that Rob does have some of these symptoms, but he doesn't have all of them.
Here, Anna uses both affect and a content response. The affect response was when Anna acknowledged the situation the patient was going through was difficult and addressed the patient's fear of it happening again. Using an affect response identifies the patient's feelings and opened up the relationship for more meaningful exchanges. The content response was when Anna responded to Mary's question of what the disease was and how it could be fixed. Anna provided information to Mary using a visual diagram and representation of what dementia is then explained dementia and what characteristics Rob may present with over time. It was important for Anna to use a content response to provide information the patient and his wife were lacking and ensure that they were properly educated.
I'm happy to hear that you're not noticing all the symptoms printed on our handout, but I just want you both to be aware that some other symptoms may show up later in the stages of dementia. I do hear that both of you have many concerns, but first, Rob, I would like to get a better picture of your daily life. Can you tell me some things that you're having difficulties with since your diagnosis?
So I really love to cook, but my wife doesn't let me do that anymore. I make gravy and meatballs every single Sunday for the past 40 years, and that's something that I still remember how to do.
It's not the recipe, Rob. It's the fact that you can't remember to turn off the stove when you're done. I'm afraid you're gonna burn the freaking house down.
Well, Mary, your meatballs and sauce aren't as good as mine, okay? One time I didn't turn the stove off, and now I can't ever cook again.
So I understand that this situation may be difficult for the both of you. Rob, I can tell that cooking is something very important to you. So let's look at this situation in a little different way. What if you cook Sunday dinner together? Not only would this be a great way for both of you to spend time together, but it also would allow you, Rob, to continue to cook, and you, Mary, to ensure that it is done in a safe manner. By doing this, Rob, you still get to participate in something you love, and Mary, you can watch over and make sure that no one is going to be harmed, and Rob will be safe while he's doing something he enjoys. Does that sound like something you both would like to try?
Yeah, I mean, I guess we could do that.
Here, Anna uses the counseling strategy of reframing. This allowed Rob and Mary to look at the positive side of the situation and help them reframe it in a new way. By doing this, it provided Rob and Mary with a new way to do something that is important to Rob while taking into consideration Mary's concerns as well. Since dementia is a progressive disease, reframing situations such as these enhances Rob's quality of life instead of reducing the activities of daily living that are most important to him. Additionally, reframing situations takes into consideration the caregiver's concern by validating their feelings and providing an alternative way to look at the situation.
I'm glad we could find a solution to that because I know it's important to Rob. However, that's one small piece of this puzzle.
I'm really scared and confused.
I'm really scared too. I'm sorry if I appear frustrated. I understand from listening to you explain more about this disease that it's most likely going to get worse. My biggest fear in all of this is that one day he's going to get to a point where I can no longer help him.
Well, we can't predict how quickly things will progress, but our focus in therapy is going to be how to help navigate through this right now and how to compensate for your difficulties. Rob, I appreciate you and your wife being so open and honest with me today. This conversation will be a great starting point for us to move forward and will really help guide our future sessions together. Working on things that are most important to you, Rob, to give you the most functional, enjoyable life possible.
Okay, that sounds good to me.
Yeah, it sounds like a great place to start. Thank you.
Of course. So let's pull out our calendars and let's try to figure out some future sessions that we can continue on.
Okay, great.
Here, Anna uses the strategy of silence. By not talking the whole time, it allowed both Rob and Mary to continue to talk and express their concerns further. By not interjecting right away, the silence allowed both Rob and Mary to continue talking and for Anna to get a bigger picture of how they feel. Rob and Mary initially came into the counseling session as an apprehensive couple with little knowledge about dementia. By using the counseling techniques listed, Rob and Mary left the session with a better understanding about what dementia is and how Anna plans to help them manage the progression in future sessions. Most importantly, Rob and Mary built the foundation of a positive relationship with their therapist Anna that will guide their future together.